Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine, one of the large medical schools in the United States. Today we're going to look at, let's say if you have high HbA1c, you've been diagnosed with the diabetes, which statin you should take. We will not impact your HbA1c. As you know, statins are the most common prescribed drugs in the United States and all over the world, correct? And if you, I think there was somebody was looking in the tap water, even if you analyze the tap water, you can find statin in there. So that kind of tell us like how commonly people use statin all over the world. And one of the side effects of the statin, a lot of people don't know, it can cause diabetes. Okay, so many literature studies and scientific studies have shown that statin can increase your HbA1c level and make you, end up with the diabetes. So today we're going to look, there's so many, if you look at statin, you get confused. So many brands, you got atorvastatin, parvastatin, rovastatin, and all of that. And what if your doctor decided to don't have the time to look at it and give you the drug and said, go and take it? Are you concerned? Of course you are, right? That's why we are here. From our standpoint, everything what we present is based purely on science. It has to be scientific studies to support what we're telling you. In today's world, if you look at the internet or YouTube, all the scientific or the medical advice is given by chiropractors and people not doctors. And they have huge following, okay? But, you have to look at it. What is the scientific basis behind everything? So through our channel, we want to bring you to the scientific evidence. So today the question is, which statin can you take so your HbA1c will not go up? Or let's say if somebody's on pre-diabetes, right? Your hemoglobin A1c is hanging around maybe 6.7, 6.8, and your doctor prescribe cholesterol medicine and puts you on a statin, and what are the chances you're going to have develop diabetes in 2 to 3 years? You don't want to take that risk. So today we're going to look at a scientific study and see what is the answer. Okay, so this study right here, the name of the study is Meta-analysis of impact of different types and doses of statin on new-onset diabetes mellitus. Like any scientific study, let's give a credit to the authors. The primary author, Iliano Pio Navarrese, MD, PhD, and it's from, let's look at the senior author, Jacek Kubica, MD, PhD. Okay. So let's see what this was, let's look at the study, okay? So it's a meta-analysis, first of all. Meta-analysis is like a lot of weight when you look at the scientific literature. That means they take a lot of studies, kind of pull together and come with the results. The best way to say, if you're following the U.S. elections, you got, so many surveys or polls, right? Like who's going to win the election. And sometimes what they do, collect all these polls about the president survey, like who you're going to vote for, and come with an analysis. Same thing, the meta-analysis, take a lot of studies, kind of put together, and come with a clear opinion, this is beneficial or not beneficial, okay? So it's a great study. Anytime if you see a meta-analysis and you find a result, you should take it very seriously. So in this meta-analysis, they have 17 randomized control study. Again, that's also great news, right? Randomized control study, you take a lot of effort to do it, and that is the gold standard of our scientific studies. They were done between 1994 and 2012, and they looked at the high dose statin versus placebo and different high dose of statin, what they look at it. And they looked at the moderate dose statin versus placebo and different moderate dose of statin. They looked at it and high dose versus moderate doses, okay? So if they, I mean, you can see clearly in this, first one they look at atorvastatin 80 milligrams placebo, pravastatin 40 milligrams placebo, rovastatin is like 20 milligram with the placebo, and simvastatin 40 milligram with the placebo, and all of those kind of things they looked at it. And what did they find? The final verdict: pravastatin 40 milligram is associated with a consistent relative risk reduction of the new onset diabetes compared with rovastatin. So with atorvastatin, not good. 8%, I mean, your increased level. When you have atorvastatin, there's increased risk of diabetes in these people, okay? So, if you have to take a message from this, is in this study, pravastatin 40 milligram is associated with the lowest risk of diabetes. Okay, we're not saying you cannot have diabetes, but it's the lowest risk. In the other, in this diagram, we have moderate dose statin comparison. You put atorvastatin was 10 milligram, and the doses: pravastatin 10 to 20 milligram, rovastatin 10 to 20 milligram. Again, here, moderate dose of pravastatin 10 milligram per day associated with a decrease, like 10% decrease. That's good enough for me, okay? So it is, and then you have moderate dose versus high dose of same statin. Okay, so what will we get out of this? We can clearly say rovastatin increase the risk of diabetes. It's a great drug, but you could end up having diabetes with 12% increase in the relative risk, okay? So again, high dose pravastatin was associated with, when the dose goes up, of course, there is also increased risk of diabetes. Also remember that. Okay, now we have this, and another great diagram, like looking at the area under curve, and then you can clearly see the pravastatin 40 milligram is, compared with the other drug, the incidence of diabetes is going to be like very less in these people. Okay. So let's look at the next one. Again, new-onset diabetes, pravastatin therapy will decrease your chances of having diabetes. And how does the mechanism, how does it work, right? I think that what they do, they go to the cellular level and modify the insulin signaling in the peripheral tissues, and they increase insulin resistance. That means insulin might not work to get the glucose into the cell, right? It also interact with the beta cells of the pancreas, and maybe there's a little bit of destruction, impaired insulin secretion. Fortunately, some of this pancreatic beta cell can regenerate. So next time, my friend, if you go to the doctor, if the doctor puts you on a statin, and ask the doctor what's the risk of, but our recommendation based on this clearly meta-analysis, the drug to go to is pravastatin. Okay, that's the one I would recommend to my family to make sure like they don't get into diabetes. You can never say they're going to, but there's still, the risk is less. If you need to take a statin, the risk is less. That's all we can say. Nobody can say they cannot cause. All the statin have this increased risk of diabetes, but if you have pravastatin, the risk of diabetes is very less. Proven scientifically. That's what our message is today. Always, please, remember that all our studies are based on pure science. When we make a recommendation, it has to be scientifically backed with studies. Please be careful when you listen to chiropractors giving it medical advice. Okay. Thank you so much for watching. Please subscribe to our channel. It takes a lot of time and effort for us to make videos like this, and with your help, we can make more videos so we can bring a lot of scientific information for your daily healthy living. It's very useful, right? All of those kind of things, very, very important. Okay? Thank you. God bless.